We're back on Born B464 with Dr. Mark Mandell-Brown and Marty Schultes and a wonderful, beautiful audience with us. And we've had some questions from the audience, and someone else would like to ask another question of you, Dr. Brown. Mandell-Brown.
Good evening. It's kind of a strange question, but do you know anything about Angelina Jolie's lips?
Well, they are, and she and of course Brad Pitt are like the couple, but her lips, we get more requests in our office when somebody comes in and they bring a picture of a magazine model, and who is it but Angelina Jolie, and they say, I want her lips. Now, interestingly, you all watch movies differently than I do. By that I mean, I was watching a movie, and there was a close-up of Angelina Jolie. It was a movie a couple years ago.
Okay.
And I said, oh my gosh, you can see that her surgeon, her plastic surgeon, made her lips lumpy.
Are you kidding me?
And in close-up, it was a movie, and I don't remember the name, but it was a very sad movie, horrible really, that where her son got kidnapped, and she was searching for him, and he was on this farm somewhere in Kansas or the Midwest where somebody was kidnapping all these children and keeping them. And I began with a C, but anyhow, in the movie they showed a close-up of her, and in the close-up you could see that her lower lip had a big lump. The only thing that can do that are one of our fillers that we have where the doctor didn't apply it evenly. And so on certain pictures you can tell, if you look at her critically from a plastic surgery viewpoint, she absolutely has had filler to her lips. And sometimes it's smooth and sometimes it isn't. Now you would think that, you know, for somebody of her stature, that they would get it right, especially before a big scene in a big movie.
Right, and with HD cameras today,
it's really tough.
It's wild. It's really wild.
And there's a female heroine in the, it wasn't a very successful movie, but it was The Lone Ranger with Johnny Depp.
Oh yes, it was a great movie.
It was a great movie, really cute. The female actress in her, if you go back and watch the DVR or the video, watch her lips, and her lips are so unnaturally puffy, the only thing that can do that is Perlane or Juvederm. And you can tell that her lips are very unnatural. So my point with Angelina Jolie is here is this beautiful actress, desired, everybody seems to desire her lips, and she herself has filler.
Right. One of the, go ahead, Mary Lee.
So how do you know what doctor to choose? Is there a...
Well, and that's a good question, and that's really a hot topic these days. How do I pick my doctor? And I think this applies, really, Kathryn, Marty, for whether it's an orthopedic doctor, your family doctor, or any specialist that you might see. But I think number one, you have to like the staff, because who's the first person that answers the phone? How do they treat you, with dignity and respect, or do they put you on hold? Are they rude? For example, my family members won't go back to a doctor's office, my dad especially, if they don't treat him well at the front desk. So the staff is important. Number two, the doctor should be board certified in either facial plastic, general plastic, or cosmetic surgery. Number three is check their facility. Does it look clean? Does it look like a nice environment? Do they have attention to detail in their facility? Some people never empty trash cans. It's dirty. It doesn't seem really clean. The fourth is, does the doctor spend time with you? If they don't spend time with you, then they don't answer your questions, and you feel rushed after waiting an hour to see them, then how are they going to treat you after a procedure? So I think they need to make sure that your questions are answered, and it's great to write down questions, and if they rush you through and you look down at your list and you don't get them all answered, and I think it's important that the doctor have that relationship, especially in plastic surgery with a patient. And lastly, do they have an accredited facility? By that I mean, do they do the procedure at the hospital, or do they do it at their own surgery center? It's great, and hospitals are wonderful. I don't want to take anything against them. If you get really sick, place to be. But when we do our cosmetic surgery in an accredited facility, say at our center, you have the privacy, the staff does this day in and day out, and there are infections in the hospital which are pretty serious these days. As you know, MRSA and other things.
Right.
Well, let's leave that at the hospital, because when you have your facelift or your tummy tuck or your breast lift or your liposuction at a center like ours, that's all we do is have healthy people. At the hospital, you don't know who the case was before your surgery. And so it could have been an amputation, it could have been a serious abdominal infection, and then they bring you in the OR. So I think having elective surgery in an outpatient center is a great opportunity. I think it's really good. So I think the doctor, the staff, the facility, and then the last thing, their certification, and then look at their before and after results. If they have a great reputation, but you look, I don't think their results look very good, well, that speaks volumes.
Right, and that's one thing that I've noticed, ladies in the audience, and also Marty, when I came to see Dr. Mark Mandell-Brown, he did such a great job there just talking to me. I felt warm with the staff, was wonderful to deal with. And, you know, he showed me back and forth all the different pictures and stuff. We just did a show recently together that you can see on all the stations around Cincinnati and New York and everywhere else, but also on YouTube. So we put the whole show up on YouTube.
great.
So you can see everything that we talked about. But I see another question out in the audience. I think it's Nancy's sister. Go
My
ahead.
name is Peggy Caldwell Schulteis, and I just retired after 33 years. My question is, at least 3 times in my lifetime, I have lost over 100 pounds, and I have a huge amount of skin underneath my arms. I'm assuming that would have to require surgery. I mean, massive. If I would have the surgery, do you have both arms done at once or one arm?
Okay.
Thank you.
Sure. And congratulations on retiring. That's always a real milestone. We call those angel wings. So some people call them excess skin, but we call them angel wings. And when somebody loses weight, sometimes the body has compensated for that extra tissue, and then when you lose that weight, you have excess skin because that doesn't contract back. So typically, you can try the venous or some of those modalities, radio frequency or ultrasound, to try and tighten the skin non-surgically. I think an important point to emphasize with the non-surgical devices is that you don't get the same goal, you shouldn't have the same goal as with surgery. So surgery, my patients are expecting 100% improvement. With the non-surgical devices, I think you have to temper your expectations and shoot for about a 20 or 30% improvement, because it's not surgery. But for the patient who has angel wings, we typically have to do what we call brachioplasty. Brachioplasty, or arm reduction surgery, is where we make an incision from the elbow to the axilla or the armpit. Now you can make this, and again, this is where you have to discuss it with the surgeon. You can make it on the inside, so when you hold your arm down, nobody sees that scar. Or you can make the incision on the back of your arm, where you never see that incision, but people can. Now people do this so that they can wear short sleeve shirts. Unfortunately, the incision is very variable how it heals. So with the same sutures, the same meticulous technique, I might have a patient that has minimal scar that you can barely see, a very fine line, but I might also have some patients that have a scar that's a little more noticeable. So there is a trade-off in surgery, especially with this, and so you can hide part of the incision with a shirt, but people are using the procedure to wear short sleeve shirts, and you still may see a little scar.
And on that note, we have to take a short break, and we'll be right back with Dr. Mark Mandell-Brown and Marty Schultes and our audience.
For more information on our show, check out our website at www.bornbefore64.com.